I had a very unique Peace Corps experience, a very unique site. The technical training was an overview of the health system and what we were supposed to work on in terms of community health. So it was like malaria, maternal child health, and nutrition. My site was different. The gold rush thing was a completely different beast. And also there was a doctor, the main chief medical officer basically of the health district was not your average health district doctor. He was getting his PhD at the London School of Tropical Medicine. So he was my counterpart.
Wow.
And he was
from Senegal.
Mm-hmm. Uh-huh. And he was very interested in working with Peace Corps. Had the first volunteer in the site. They had done some really cool projects together. They had started this universal bed net distribution campaign that had then been scaled out to the rest of the country.
What distribution? What?
Bed net, and they had started this condom distribution network. They had really worked well together. And so this doctor was gung-ho about working with Peace Corps, and that is why my husband and I were placed early on in this site, because they said we are going to have enough work for 2 people and someone that's studied public health and in graduate school. So I would say that my graduate school training did more to help me. The orientation that we had in terms of technical training, in terms of the specific health system in Senegal and how that worked, and culturally how to navigate all of that was immensely useful. But we were just doing different things than anyone else in the country.
Talk about that, and talk about how the gold rush.
Yeah, so I mean,
impacted
really, I had no idea. I didn't know anything about gold mining besides what you learn about, the 49ers in the U.S. and where we lived was the Wild West. It really was, and the main health. It exacerbated every health problem because for example, the biggest gold site at the time that we left. So when we arrived, there was 200 people. It was a village. When we left, there's estimates between 30 and 50,000 people. They just don't know. And it was...
In the 2 years you were there.
Mm-hmm. Oh, and that was over a 4-month period that everyone just came in. And that was about 30 kilometers from us, and they would come through our village on the way. And there's one well, one pump for water. So all the diarrheal disease, there was a typhoid outbreak there. How do you do a bed net distribution when people are living in these shacks there, and it's just... You can't do a census to figure out the sleeping arrangements in order to distribute nets. There was a hepatitis E outbreak. It was in Dakar. It was so far from Dakar that the government just did not know what was going on because it was all happening so quickly.
And this was all men, I assume, or
mostly men, and then some women and children too that would come, but mostly it was large majority men. And then there was a sex trafficking situation with women from Nigeria. And so then the HIV issue, where it's not much of an issue in most of Senegal, but then all of a sudden had become one in our area. But then the main, directly related health issue that we were working on was trying to do harm reduction around the use of mercury in gold mining. So the way that it works is that they'll go down and they'll dig these big, well-shaped holes, 100 meters down, come up with these big chunks of rock, pound the rock into small pieces, and then grind it in a mill situation, and then it's just this powder, and then they'll put mercury in the powder. And
just bare hands.
Mm-hmm.
Right.
The mercury will bind to the gold and to create this amalgam, and then they just burn off the mercury in a spoon, releasing all of that mercury gas into the air. And people knew that it wasn't good, but they didn't know why.
So where did they get the mercury?
Black market. It's illegal, but there was a lot of decommissioned power plants that had used mercury formerly. I heard that the dentist's office would put it onto the black market. So it was just sold around.
And individuals bought it themselves.
Mm-hmm.
Or were there
bosses? And then there were gold buyers, and the gold buyers were the ones that were using it the most. But you could find it anywhere. Either you would take your rock to the gold buyer and they would do that process themselves, or you would do it yourself and you could bring it to them. So really there was several different ways that you're doing this. So the person that had been the first volunteer in our village, so he had left there, and then he was replaced by a second-year volunteer because he did so many things that they couldn't replace him with the first-year volunteer. So he'd been gone for about a year, and he'd started medical school, and he put in this proposal because he was already seeing it start to happen when he was leaving. So he put in a proposal for research funding from the State Department to do some operational research around gold mining and mercury use. The project was doing this peer education training model where we'd work with community health workers, and then they would train a network of gold miners as peer educators to talk about the dangers of mercury, how like best practices in like in terms of reducing the harm. So like where is the best place to burn where you're away from people. And then we also worked with a welder to build these pipe retorts that trap emissions, and we marketed it as like, this will actually, you can recuperate your mercury, you don't have to buy it again, it's a better economic deal, oh, and you're not poisoning this community. And it had varying levels of success. We saw that like knowledge really did increase through the project, but people didn't.
And what was your role in this project?
Our role was pretty hands-off, like training the community health workers and training the peer educators. We did not want to be in the gold mines, because the other layer of complication was that the reason that this gold rush was happening when it was that they had recently, in the mid-2000s, opened up the land for leasing from Western gold mining companies. And then they'd been finding gold, and then people started realizing that there was so much gold in this area. So people were coming in from all over West Africa. And so we, as Westerners, did not want to be looking like we were in the business of finding gold. And so we really were working on like a trainer of trainers model, where we were working with community health workers in the affected areas, and then serving as a resource for them, as well as training interviewers for these pre and post surveys about mercury knowledge and behavior. It changed knowledge and it changed behavior some. Like people were more likely to have used a retort, a little bit, but there were reasons that they didn't want to use it, because they didn't want people to know. If you go to a designated burning area that's away from people, you're exposing the fact that you found gold, and it puts you at risk of bandit attacks. It puts you at risk of being discovered by the police, because you're not supposed to be mining gold, you're not supposed to be using mercury. And so people were pretty reticent to like follow the best practices, even though they like got it, but when you have these people who have had, I speak for the Senegalese, like they were subsistence farmers, and all of a sudden they have this opportunity to possibly strike, probably not, but possibly strike it rich. It's hard to change those behaviors. The other thing was that kids were dropping out of school like flies. So we had this, idea that we would paint this mural that said, "My future shines brighter than gold." And, that would maybe inspire them to stay in school, even though the temptation to mine gold was so great.